Hello and welcome. This is Dr. Rahul Kashyap and Dr. Fazal Nawaz on behalf of GRRSP, Global Remote Research Scholar Program. Today we are doing our presentation, how to give effective virtual scientific presentation. If you take the virtual part of it, effective scientific presentation would apply to you as well. Those who are not muted, please mute yourself so that we can have a good recording of this session today. What I'll cover is, we'll cover these three parts: scientific, effective, and virtual in this order. Scientific presentation, how to make it effective, and then some tidbits for virtual if you're doing Zoom or any other virtual platform. Let's start with, let's say if you've submitted, you completed a project, you submitted a project, an abstract, and now you're invited to give a scientific presentation, maybe an e-poster or maybe a PowerPoint presentation. Today's focus is on PowerPoint presentation. You have a relief that, oh my gosh, I meet the deadline, I submitted, and then once you get the news of that it got accepted, and anxiety set in. I was like, oh my gosh, now I have to be in front of a people on a podium or on a Zoom. I've never done this before. But worry not. I think I would see it as an opportunity for growth, where actually you can shine in, and that will be very helpful no matter where you are, what track you are in residency, fellowship, and things like that. I'll focus on scientific part of it. So first, making sure that your first slide or the presentation you have it, which has a title, which is informative. I've given an example for one of our presentation where you have the patient population, sepsis patients, your exposure, your outcome, and then study design. Usually I want to keep my title informative, that people read the title and they exactly know what we did. Retrospective cohort study, looking at sepsis patient population, increased fluid administration in first 3 hours, and its association with mortality. I can't make it as simply as possible, as simpler as possible. This is a little bit longer, but you can do a little bit more tricks to that as well. Of course, you want to list your author list and affiliation, or just the author on the front page, title and author, or all the team members should be listed in your first page. That is something you can do it as well. Next few slides, you can follow your background. Simple bullet points here. I'm just giving an example from abstract where you write down the principles you learned through GRSP or some of the videos we have listed. You write down the 4 points, why it is important, what is the knowledge gap, what has been done, and what you're trying to fix the knowledge gap as well. You may take a slide or 2 slides to write down your method, and I'll give a little bit on detail. This is an example of an abstract at this point. You write down your methods, what was the set of the study, what you did, what was inclusion criteria, what the analysis, and so on and so forth. And then you sometimes add your inclusion criteria, I add B. If meta-analysis, include your inclusion, exclusion criteria, includes your search terms, and includes your databases, duration, numbers, everything you can use into method section. Result for this abstracts for clinical study, you talk about how many patients, what happened, univariate analysis, multivariate analysis, your tables, your figure, your forest plot, your consort diagram, all Prisma diagram goes into result section. Sometimes if you have enough data, you write down the demographic and number of patients in each group and things like that too. Concluding it, keep it simple. Your conclusion should reflect back what you study, and tying it back with your title or your primary aim is going to be important. Remember the primary aim, the title I showed it to you here, and this is the title, is tying it really back with your title, what you're tying it. So that is another point I would like to bring up, that make sure your conclusion is only what you studied. Don't be aspirational. Don't give them ideas for next paper and all. You just talk about what is being done, and that's it. That's a part of how you write an abstract or how you put it down, these things. Now let's go into detail with each point of it. So if I have to turn this abstract into a presentation, my first slides, bold letter, I should include my name and my team's name, and then where you're presenting and things like that too. Use a figure and image. That's always a good idea, which is pertinent to. You don't have to overkill it, but using 4 to 5 images in whole presentation is a good idea. Point number 1. Write a background. In this one, I wrote down that there are not enough studies done in this part, early goal therapy, how earlier session is better, later session is worse, and I use only bullet points. I build up, I use these as guidance to tell my story. So you can do the same thing too. Write down a few bullet points where you can actually talk about your study. This background section, you already have prepared these. So just writing it down into bullet section, don't write and fill the information. See, there are 4 and 5, 6 bullet points. Put down for your own guidance, and then you can have your notes on the side and you can use the guidance. You don't need to read the thing what is written. That's the last thing you want to do. Don't read the slides. Use them as a guidance, and then give a talk. An image, if you have put down an image or figure from internet, fine. The next thing is hypothesis. My hypothesis was there's an association between this. My hypothesis that this one you can read it verbatim, because hypothesis is important to read it. Appropriate fluid cessation and patient outcome within first 3 hours compared to second 3 hours. And I throw a figure right there in this part. See the font size, See the things you can include. Don't include more than 7 bullet points in an image in a slide. That's a rule. People can't read it. They will not be upset, and don't make it the words too small. Then my study design. Here I listed down my inclusion exclusion criteria, bullet points, not sentences, not too full. And in the backdrop, I give the example, the list of citations you can put down if you have citations about what the studies you have used it. Then method section. I talked about how we collected the data, what different data points I collected from, what different logistic regression I did it. And here, if you're doing a systematic review meta-analysis or you're doing a social media related things, you list down your method section in a bullet point, in a figure, whatever it is to make understand people that that's what you did exactly. Most question comes from methods, so be very careful about it. You can have two slides for methods. That's my flow diagram for study, total number of patients excluded. You can create them simple black and white into the Word document. Your Prisma diagram should be there, or your social media. If you did down total searches, you can create any sort of flow diagram which is pertinent to your study. Then results, total number of patients, if systematic meta-analysis, total number of articles you included, what was the median age, things like that, total number of male, female, total number of people in each group, whatever is pertinent to you, 4 to 5 bullet points, maximum 7, minimum 3. That is a rule you want to have it. Then table. This is not a great example, but put down your table, put down your figure, put down your forest plot, whatever table figure you want to talk it through. Just give a brief result in the beginning and then say, hey, these are two groups, let's see the differences between these two, and then significant. You don't need to read every single word here. Saying, I would like to bring it out to your notice that the patient population in non-survivor group is younger, or male, they're less male, more female. The age is older, compared 74 versus 69, significantly, it's statistically significant. Other things are no difference in weight, BMI. Apache score is also different. The people have higher Apache score, called Charlson comorbidity, no differences. So you are doing a highlight of this result rather than reading every single thing. Make your story. You have to prepare your slide, then practice it, write down. That's where you come to it. Otherwise, you'll end up reading your slides, and that's the last thing you want to do as a presenter. Then second table, don't make it too crowded. I just want to make a point there. You can split them into 3 slides or 2 slides, or then you talk it out. Sometimes you can create a red color box around it that comes in a animation. Don't make too many animation. Just like I did one that it's coming up later to draw your attention. If the slide will be too busy, I said focus on this part and now focus on that part. That was my trick, to use a busy slide, but still make it cognitively okay to all of you guys. Then finalize your result. Like my unit analysis, I had this amount, like first 3 hours of survival at discharge were almost 2100 ml compared to 600 ml. So there was a difference of 500 ml. The people who survived, they got higher amount of fluid in first 3 hours, significant p-value. And when I compare to later 3 hours, there's no difference. They got the same amount of fluid, a little bit extra, but not significant. So what I'm telling is that people who survive, they got first 3 hours, they got a higher amount of fluid. And it's one of the data from a major institution, which is one of my studies. This is a second analysis I did it. It made it to chest. So, and after we adjusted for these things, it's still the proportion of amount fluid given in first 3 hours was highly significant, protective with odds ratio 0.3, p-value of this one. So it gives you an idea. This was a chest paper. You can actually read it out. I took a screenshot from my own paper to make a point right there, and I listed down and using some of the images and all to convey the point. In the end, the conclusion that after adjusting for blah, 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 then my results are that early administration has a potential to reduce mortality. I underlined it, no different color, nothing else. So I'm just using my initial point as well. Always leave your last slide. At the time it was my affiliation from my institution. You put down your tweet handle, Twitters, and whatever your social media profiles and things like that. I would use it as a class contact slide, as a thank you slide, and a question and answer slide as well. So far in 5 to 7 slides, how you prepare your slides. This was an old presentation, so you should be using all possible newer technology available to you, where you can actually have a slide sort of slide formatting and all those things to make it beautiful. Don't make it too crowded. Don't make it too wordy. That's the only thing. Now, effective presentation, maybe 2 slides on that. So first thing is lessons from Toastmasters, practice. There data that people spend 90 to 95% time on preparing the slides, less than 5% practicing it. Practice it. Anytime you're presenting it, and your next week presentation, those who are at the time of recording, who are going through their graduation presentation and our GRSP annual Congress, this is a great place. If you don't practice, it'll be reflected. So this is a good time for you to practice, do at least 2 practices. Sit down, time yourself, say I have to present it in 10 minutes, I would put the timer, go through, watch it. You can record and watch what mistakes you're doing it, and then go. Just relax. Nobody knows about your topic more than you. Try to use vocal variety to emphasize on the points, or go and slow down. This is not a great example when I'm doing it. I'm doing it pretty paced presentation. I would like you to be relaxed and then speak slowly to make sure that you're pronouncing and enunciation every single word properly. Be aware of your filler words, the verbal static, like ahs, ohs, so and so's and all. Okay, then on this, don't read the title. So don't worry. Our brain thinks faster than our mouth can speak. So take a pause and keep speaking, trying to use no filler words or minimal filler words like ahs and so's and ands and thens. That is lessons from Toastmaster system. Your opening should be very important, where you draw the attention. So tell why this is a big problem. Why, catch your attention in first 10 seconds. Tell them what you're going to tell. Like I told you that I'm going to be covering these 3 points, and then I'm telling you what I'm covering it, and I'm going to summarize them in the end. So tell them what you're going to talk, tell, and then summarize what you just talked, and have a strong ending. Tell them this is a conclusion. I invite you to read my paper, or give me suggestions, or join me in the research if you want to do some collaboration with the multi-site sites as well. Start on time, end on time. Don't forget to have a smile, because we get so tense when we're presenting it. We are worrying about what people are thinking. We are worried about we will do a good job or not. You practice enough, you come in, give a smile, make people feel welcome. Those people who are sitting in audience, or those are other side of this presentation, they're cheering for you. They want you to succeed. We want you to succeed as a faculty. So make sure to remember to smile time to time, and then you don't need a talent to start on time and end on time. Okay, so that is something you can finalize. The last part, the virtual piece. This is an extra component. It became a pretty norm since COVID-19 as well. And these are the few slides I prepared, and they are available on different videos as well. But just very briefly, when you're doing a presentation, make sure there's a natural light coming in. If you can afford to have it, it's not too cold for you. Face the natural light. If there's a window, put your table behind against the window, let the window open or be closed. If there's too much noise, keep it closed with natural light coming in, or have a lamp right behind you, so there's an equal light. So right now my this side of the face is a little bit darker because my window is this side. So those are things you can focus on. If I turn myself a little bit all, it's a little bit more equal on both sides. Make sure that your laptop is on even surface. You're not too high or too low so that people can only see this one. That is a big no-no. This is also a good interview practice when you're doing your interviews as well, making sure that you're not too much in this sense or all. You're pretty much okay. Put the bookshelf, couple of books as well. If you have to keep it high, keep on the even surface as well. Don't look down, don't stand up. If I stand up and talk to you like that, this is going to be a pretty bad view of doing it. If you can afford to stand up and then bring the laptop to the same level, it gives you a little bit more of flexibility and give you a little bit more of hand gestures and things like that. I do that when I do the public speaking. And if you can afford to do it, like you have a good height of laptop on area, I would let you stand up, take away the chairs away from you so you don't trip and fall, and then use your head gestures and move forward, back and forth on side. Make sure to stay within the Zoom window period of it. Surrounding, find a quiet space, silence your phone, turn off your notification, let people know that you're giving a presentation, put a paper outside the doors, and don't disturb recording in progress or interviews in progress and things like that. Have a professional background, a virtual background, a book, curtains, plain wall. Doesn't mean that you have to build a new wall or get a new bookshelf. If you have it, use it. If not, remove any unwanted items from the back you don't want to see. The treadmill, the clothes getting dried up there, or any paper lying around, or kitchen's mess. You don't need to put a virtual background. You don't have to worry about it at all. If you don't want to put a virtual background, find a plain wall or a curtain, and then that should do it as well. Don't try to put a new plant there and then trip over and then water dripping and all. Don't do that. Just keep it simple. Life is complicated enough already. Yes, I'm going to talk about makeup. So those who think it's helpful and it's okay with that, you can always use a lighter makeup. Maybe a small powder or concealer. Otherwise, sometimes there is a reflection or sweats and things like that as well. Or there are Zoom touch-up buttons too. I have not used them, but make sure, feel free to do that. There's no harm in doing it. Many people, both male and female, they do it, and then it's perfectly okay. Remember, when you are doing the eye contact, when you're doing a presentation, we tend to look at our own video, which I'm doing it right now, compared to look at the camera. So time to time, remember to look at the camera. That means you're speaking to the people directly. Smile, I already mentioned. I cannot overemphasize on smiling how much forgotten it is. Use your expressions, use your hand gesture, use your smile. You make friends, people you like. The reviewers, the judges will be there on the annual congress and all. You want them to come across a natural speaker. Maintain your focus. Don't do the presentation sitting like that and legs up and things like that. Lean forward. That means you're telling people you're interested. You really mean this presentation means a lot to you as well. Test your volumes and earphones and all those things beforehand. You can practice with your friends, family, or somebody else. Come on time, before on time, and test all those things. You should not be struggling with that. Always remember to look at yourself to see if you're muted and you're speaking. If the mute button is already there, you see if it's not red, that means you're good. Be 10 minutes early so you get a chance to relax. If you're doing an interview, a presentation, our own presentations, that is very, very important. That be before time, be ready, get your water bottle. If you're doing your slides, print them or keep them aside on a different version. Let them know you may refer to them. Let them know if your CV is printed there, any generic questions they'll be asking online. Anything else, rehearse, prepare, and practice. If you're doing interviews, all those things you can find it. You can practice all those things before happen. Ask around audience. If you don't know what your audience are, I usually ask. So tell me how many of them are nurses, how many of them are doctors, how many of them are students, and then you can always relate with examples. And some of these things came from the Forbes article I read it in 2020, where they talks about how you can excel in interviews on Zoom or other places as well. So be ready, have your notes ready, practice, 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 and then research your audience. If you are presenting into our group, you don't need to research us. But if you're presenting outside, that'll not be a bad idea for you as well. So in summary, my take-home points are less is more, less slides. You cannot fit 20 slides in 10 minutes. The rule is 1 slide per minute. If somebody tells me I have to give a rundown, I ask them how much minutes, say 45 minutes. Then I prepare 45 slides. Somebody tells me you have 20 minutes to present, then I prepare 20 slides. Somebody tells me you have 7 minutes to present, I prepared 5 slides. 5 minutes to present, 5 slides. 3 minutes, 3 slides. 1 slide per minute. Making sure that you're using all components of research: title, background, method, result, conclusion. If there's future direction, future direction. If you publish something, put down in there. Make sure to remember the effective piece of it as a timely, vocal variety, pauses, and filler words, the lessons from Toastmaster. Make sure you're leaving as a conclusion, like what I'm doing it right now, and take home message or content information. And virtual environment, awareness of your surrounding, eye contact, postures, all those things play a huge role that can make a mediocre presentation to a rock star presentation. And ultimately, remember to relax and enjoy, because you feel much better once you're done with the presentation. So try to enjoy the process, try to practice, enjoy that process, and then just give your presentation as well. With those words, I'll leave you our GRSP official email as I promised, and then our Twitter handle and things like that too. And I'll open up for questions.